Here we have a model that shows an ovary in a larger view. I can see a small piece of ovarian ligament. Recall, ovarian ligament attaches ovary to the lateral side of the uterus. I see a small section of mesovarium. This is a double fold of peritoneum that holds ovary in its place. The ovarian hilum is supposed to be here. That's the place that blood vessels, nerves, and lymphatic vessels enter or exit the ovary. Basically, they supply the ovary. And then when I get closer, I see on the external surface of the ovary, we have a surface epithelium. This is an epithelium that is made of one layer of squamous, flat cells or low cuboidal cells. We name this layer mesothelium. Under the mesothelium, we have a white capsule made of dense irregular connective tissue. We name this capsule tunica albuginea. And deep to tunica albuginea, we have part of the ovary that is referred to as ovarian cortex. In the ovarian cortex, we have dense irregular connective tissue full of bundles of collagen and also fibroblast-like cells named stromal cells. And also we see that in the ovarian cortex, we can see these round structures that we name them ovarian follicles. And when in this video I talk about oogenesis, basically I follow the growth of these ovarian follicles. Please keep in mind, sometimes these ovarian follicles turn into fluid-filled sacs that we refer to them as ovarian cysts. Ovarian cysts are relatively common. Usually they are non-cancerous. Frequently they disappear on their own. So basically in most cases, when we diagnose ovarian cysts, we do not need any treatment plan unless we are suspicious that they are cancerous cysts, which the cancerous cysts more likely occur in women over 40. In that case, obviously, the cyst should be removed. We need biopsy. We need to send a sample to the laboratory. But in general, as I mentioned, most of these ovarian cysts do not need any treatment. However, they might cause some discomfort for the female. For example, some female experience pain and pressure or dull ache or fullness in their abdomen. Some female experience pain during sexual intercourse. The menstruation could become irregular, painful, or delayed due to the presence of ovarian cysts. Some female express that they experience sudden sharp pain in their lower abdomen or vaginal bleeding could happen. In general, as I mentioned, in most cases we do not need any treatment unless we are suspicious that the ovarian cyst could be cancerous, or if the ovarian cyst has a diameter larger than 5 centimeters, that would equal about 2 inches, which in that case, they may be removed surgically. So in short, we're looking for ovarian follicles in the ovarian cortex, and then the deeper part of the ovary is called ovarian medulla. In the medulla, we have loose connective tissue and blood vessels, nerves, and lymphatic vessels. So as a short summary, when I start from the superficial and go deep, we have mesothelium, tunica albuginea, ovarian cortex that contains the ovarian follicles, and then ovarian medulla. Now we are ready to talk about the process of oogenesis, but before I start this process, I would like to remind you that spermatogenesis in males starts at puberty. However, oogenesis in females starts before birth. During the fetal life, some primordial germ cells migrate to the ovary, and then when they get inside the ovary, those cells turn into oogonia. When we say oogonia, we mean stem cells. So oogonia are stem cells capable of fast cell division, and these cells are diploid. They have 2 sets of chromosomes. The oogonia multiply and add to the number of oogonia. However, we notice that most of the oogonia actually degenerate and die through the process of atresia. So basically, female loses most of those oogonia, most of those stem cells. Some of those oogonia differentiate into a cell that is called primary oocyte. Primary oocyte is a cell that enters the prophase of meiosis 1. Now let's remind ourselves that in oogenesis and spermatogenesis, we need the process of meiosis simply because we start with diploid cells that contain 46 chromosomes, and we would like to form haploid cells. The haploid cells contain 23 chromosomes, and the process of meiosis allows us from diploid cells form haploid cells. So primary oocyte enters prophase of meiosis 1. However, primary oocyte does not complete meiosis 1. So basically, it just pauses in prophase of meiosis 1. And meanwhile, a layer of flat cells wrap around the primary oocyte. And then we have a little bit of the stromal cells also wrapping around this structure that is forming here. We name these tiny little structures that form primordial ovarian follicles. Recall, inside we have a primary oocyte. Around the primary oocyte, we have one layer of flat cells. We name this one layer of flat cells follicular cells. Female is born with these primordial follicles. And when we count the number of primary oocytes in the ovary of a female at birth, we see that we have about 200,000 to 2 million primary oocytes in each ovary of the female. From birth to puberty, most of these primary oocytes degenerate and die. When we get to puberty and we count the number of primary oocytes again, we see that we are left with only 40,000 of these cells. And throughout the female reproductive life, which would be from puberty to menopause, we see that only about 400 of these cells eventually become a cell, or it's better to say form a cell, capable of participating in reproduction. So clearly, the strategy that female genital system uses is very different from the strategy that male genital system uses. On daily basis, male genital system produces about 300 million new sperms. However, in female genital system, in every female cycle, which in this video we consider it 28 days, one cell is produced. So the focus here is mostly on producing one high quality cell. Male genital system is focused mostly on quantity. Female genital system is mostly focused on quality. We need both quality and quantity to form a healthy living organism. Now I go back again to the primordial follicles. From birth to puberty, we just wait, and most of them actually degenerate. We lose them in a female. When we get to puberty, we know that hypothalamus releases gonadotropin releasing hormone that stimulate anterior pituitary to secrete follicle stimulating hormone and luteinizing hormone. Follicle stimulating hormone through bloodstream travels to the ovaries of the female, and in each cycle, follicle stimulating hormone stimulate a few primordial follicles to grow and turn into primary follicles. So as you see, the size is larger. And when luteinizing hormone gets involved, luteinizing hormone promote more growth and make these follicles to become the largest follicle that we have here, a mature follicle. So we can say that follicle stimulating hormone initiate follicular growth, and luteinizing hormone helps completing their growth. So now I go back from primordial follicle. Due to the presence of follicle stimulating hormone, we end up with primary follicle. Even though the model does not show the details really well, but let's just quickly say that inside the primary follicle, we have the primary oocyte that is stimulated by the presence of follicle stimulating hormone to continue meiosis 1. The goal is to eventually complete meiosis 1. And we see that the cells around the follicular cells from flat turn into cuboidal, and they start multiplying. So when we look at this larger follicle that is called a secondary ovarian follicle, we see that we have more than one layer of cell, and these cells are cuboidal. As soon as we have more than one layer of cell in the surrounding of the ovarian follicle, we change the name from follicular cell, we change the name to granulosa cells. And granulosa cells secrete estrogens and inhbin. So secretion of estrogen and inhbin from granulosa cells starts, and inside primary oocyte is trying to complete meiosis 1. And here we get help from also the stimulation that we receive from luteinizing hormone. Please keep in mind, even though in both ovaries, a few of these primordial follicles got stimulated by follicle stimulating hormone and started growing, in every female cycle, more likely we end up with only one dominant secondary ovarian follicle. The dominant is the follicle that outgrows the rest, and then the granulosa cells of these follicles secrete estrogens and inhbin. We know that the estrogens and inhbin decrease secretion of follicle stimulating hormone. So the other follicles that did not have the fast pace of the dominant follicle, because they're not receiving enough follicle stimulating hormone, they degenerate and die. So we end up with one dominant secondary ovarian follicle. In those cases that the female become pregnant with non-identical twins, usually we have 2 or 3 secondary ovarian follicles that they become co-dominant. Means none of them is faster in growing than the other one. So all 2 or 3 of them survive. All of them go through the process of ovulation. So we end up with 2 or 3 of these cells released into the pelvic cavity. And we are not concerned about the numbers of sperm, because in a typical ejaculation, about almost 450 to 500 million sperms are released. So if the ovary of the female releases 2 or 3 of these cells, we really need 2 or 3 sperms to fertilize them. So that's the story of how many secondary follicle usually we get, which the answer is in most cases just one, and only the dominant one survive, and the dominant one makes sure that the other ones die. When we receive more of the luteinizing hormone, we can say that the story kind of completes. We end up with a large follicle, which is the largest, and we name it mature or tertiary follicle, or we can name this Graafian follicle. And please keep in mind that at this stage, luteinizing hormone helps primary oocyte to complete meiosis 1. At the end of meiosis 1, we get 2 haploid cells, but the size of these 2 haploid cells is not the same. One cell contains 23 chromosomes, and most of the cytoplasm, we name this cell secondary oocyte, and the other cell is a small cell that contains the other 23 chromosomes and a very small amount of cytoplasm. We name that cell first polar body. Sometimes the first polar body divides into 2 polar bodies, but sometimes it doesn't divide. In general, we can say for the purpose of this video, it doesn't matter, simply because the polar bodies are not involved in reproduction. The cell that we use for the purpose of reproduction is secondary oocyte. Luteinizing hormone stimulates the mature follicle to eject the secondary oocyte into the pelvic cavity, and we know this process is called ovulation. So near the time of ovulation, we have a rising level of luteinizing hormone. And that's exactly what over-the-counter home tests are detecting. When we try to predict the day of ovulation, those test kits can actually detect the high level of luteinizing hormone. Usually 9 to 10 hours before ovulation, the level of luteinizing hormone significantly increases. When secondary oocyte successfully is released into the pelvic cavity, then we know that the fimbriae of the fallopian tube and the motions of the cilia pull the secondary oocyte in, because fertilization must happen inside the fallopian tube. Now we're following the secondary oocyte that was ejected out through the process of ovulation, and let's say that fallopian tube successfully pulls the secondary oocyte in. Secondary oocyte is a cell that has a short lifespan. We have about 24 hours to fertilize the secondary oocyte. If the sperm is not present, secondary oocyte does not complete meiosis 2, it degenerates and dies. But if sperm is present, preferably in the ampulla of fallopian tube. One lucky sperm get close to the secondary oocyte, and as soon as the membrane of the sperm unite with the membrane of the secondary oocyte and the head of the sperm start penetrating into the secondary oocyte, the process of fertilization starts, and it stimulates the secondary oocyte to complete meiosis 2. So in order to complete meiosis 2, secondary oocyte needs the presence of sperm. Without the sperm, it cannot complete meiosis 2. While the sperm is trying to get into the cytoplasm of the secondary oocyte completes meiosis 2. At the end of meiosis 2, we get 2 haploid cells. One cell, again, is large, contains 23 chromosomes, and most of the cytoplasm, we call that cell ovum. Ovum and sperm unite and form one diploid cell that contains 46 chromosomes named zygote. The other haploid cell that forms at the end of meiosis 2 is called second polar body. Recall, polar bodies are not involved in reproduction, so the second polar body degenerate. From the moment that the sperm start penetrating into the cytoplasm of the secondary oocyte becomes stimulated to complete meiosis 2, ovum forms, and then ovum and sperm unite together. This process usually takes about 24 hours. So when zygote forms at the end of these 24 hours, we see that about 6 to 7 hours after zygote forms, this one cell start multiplying, start mitosis. So eventually we end up with 2 cells. Then those 2 cells divide, we end up with 4 cells. And as you notice, while the cell division is going on, the movement toward the uterus is happening. Simply because we know in the wall of the uterine tube, we have ciliated epithelium, and also we have smooth muscles. Cilia and the smooth muscle contraction both help moving these cells toward the uterus. Also, it is important to note in the lining of fallopian tube, we have some cells named PEG cells. PEG cells secrete nutrients to nourish the cells that we have inside. So from zygote, we ended up with 2 cells, 4 cells, 8 cells, and then when we get near the end of isthmus, we must have 16 cells. And keep in mind, all these cells are identical. We name that little ball of 16 cells that leaves the fallopian tube and enters the uterine cavity, morula. So in morula, we have 16 identical cells. When we get inside the uterine cavity, more cell division is going on, and then some of the cells start differentiating. So we end up with different type of cells, and eventually a structure named blastocyst form. And we know that's the blastocyst that goes through implantation, penetrates into the wall of uterus. And please keep in mind, during this time, the area should be very quiet. To make the myometrium of the uterus quiet and relaxed, we rely on relaxin, the hormone that is supposed to be released from ovary. So that's the process of eventually getting pregnant. Now let's go back inside the ovary and see, after ovulation, the part of the mature follicle that is left is going to turn into what structure, and what will be the function of that structure. Now we are back inside the ovary to see, after ovulation, what happens to the rest of the tertiary or mature follicle. We see that the rest of the tertiary follicle eventually turns into something yellow that is called corpus luteum. And from corpus luteum, the release of 4 female sex hormones start: estrogens, progesterone, relaxin, inhbin. Please keep in mind, from the granulosa cells also, throughout the process of oogenesis, we had release of some estrogens and inhbin, but corpus luteum increases the secretion of those hormones and also starts secreting progesterone and relaxin. Speaking of relaxin, we know that relaxin that is released from corpus luteum is going to calm down the muscles that we have in the wall of uterus, the myometrium, that increases the success of implantation of blastocysts. Inhbin that is released from corpus luteum suppresses release of follicle-stimulating hormone and luteinizing hormone. Why? Simply because the female genital system first wants to know what happens to the secondary oocyte. If secondary oocyte encounters the sperm and female becomes pregnant, we do not wish any more of these follicles start growing and going through ovulation. So basically, the process of oogenesis should be paused throughout the stages of pregnancy. However, if secondary oocyte does not meet sperm inside the fallopian tube and female does not become pregnant, in that case, corpus luteum turns into a white scar tissue that we call it corpus albicans. And corpus albicans does not release hormones. So when we do not get any more inhbin, then follicle stimulating hormone and luteinizing hormone secretion rises, which that leads to the next oogenesis process to start. Usually in a female cycle that we consider it in this video 28 days, corpus luteum lives about 14 days. So during these 14 days, it keeps releasing estrogens and progesterone, which we know estrogens and progesterones have many different impacts, but for the purpose of this video, we can say that estrogens and progesterone stimulate the basal layer of the endometrium of uterus and make the basal layer to keep adding to the thickness of endometrium and make the uterus ready for the implantation of the blastocyst. Progesterone that is released from the corpus luteum also impact the mammary region, the mammary glands of the female. So during the time frame that corpus luteum keep releasing progesterone, female can actually feel some sort of enlargement and tenderness in the mammary area. As I mentioned, what happens to the corpus luteum depends on whether the female becomes pregnant or not. If the female is not pregnant, which the indication would be unsuccessful implantation of blastocyst or no blastocyst goes through implantation, then corpus luteum turns into the corpus albicans. When we analyze the medulla of the ovary, we notice that the medulla is full of these scar tissues, the remaining of the corpus albicans. However, if implantation of blastocyst successfully happens, corpus luteum does not turn into corpus albicans. It stays and continue releasing estrogens, progesterone, relaxin, and inhbin to basically help pregnancy to continue. Later, when placenta forms, placenta start releasing these hormones and help increasing the chance of success of that pregnancy. So this was a short summary of the process of oogenesis, and I would like to mention, even though the lifespan of secondary oocyte is short, it usually can stay for up to 24 hours waiting for the sperm. But it is important to note that these sperms, when they get into the female genital tract, it's been shown that they can live for, in some cases, even up to 7 days. And that's the reason for some of the unwanted pregnancies. That several days before the actual ovulation, the couple involved in unprotected sex, thinking that ovulation is going to be 3-4 days later, but the sperms that are ejaculated into the female genital tract wait several days patiently for the secondary oocyte, and when ovulation happens, then one lucky sperm can start the fertilization process and pregnancy happens. So it is in general important that we pay attention to the lifespan of cells or structures that we have. And the process of oogenesis in this video, from the moment that follicle stimulating hormone stimulate the growth of a few of these primordial follicles, and primordial follicles turn into primary follicle, and usually, in most cases, we end up with one dominant secondary follicle. We receive the luteinizing hormone that basically helps. We get the mature follicle, which is involved in ovulation. And then after ovulation, we have corpus luteum, which after 14 days, if the female is not pregnant, turns into corpus albicans. The whole process is about 28 days. And the ovulation is usually around the mid of this 28-day female cycle. I hope you find this information helpful.